There is no question in my mind that many more thousands of Americans will die earlier than they should. In other words, they are being sentenced to death without having committed any crime other than being poor. What is especially tragic and reprehensible is that with the kind of childhood poverty rates we are seeing today, unless we turn this vicious circle around, we are dooming a significant part of an entire future generation to unnecessary suffering and premature death. This is not what America is supposed to be about, and we must not allow that to happen.
Anyone who wishes to equate poverty with death must go to the third world to do so. Anyone wishing to equate poverty with death must seek out socialism and tyranny. Those who wish to see death from poverty in our country are blind to the truth. Over time, poor Americans became healthier than wealthy Americans of a previous generation. Only in America would we label it as a death sentence for the children of poor families to have a reasonable expectation of growing up healthier than the adults of wealthy families did in the immediately preceding generation.
We're number one in child poverty among the industrialized countries. There's another thing we're number one on, which is spending on medical care, and yet we consistently rank at or near the bottom on measures of health like infant mortality and life expectancy, and many experts believe that it's because of child poverty.
Are we having a situation in this country where millions and millions of people, and let's remember we have 50 million people who are uninsured, are not able to get to the doctor or the hospital or afford it, and in fact are dying or suffering unnecessarily?
My question is for Dr. Halsey when I ask it, have you ever seen anybody, any patient who died in Kentucky in your 30 years in practice for lack of health care?
No, sir, I have not. I do think that the resources are available out there. There is really no reason for a patient not to find a doctor who will take care of their problem with no remuneration.
Today, I understand there's discussion here about shifting even more costs onto patients. You can see from my perspective, this makes no sense. For anyone lacking resources, the natural consequence of any out-of-pocket cost is that they withhold needed care from themselves, with devastating clinical consequences and at high cost to society.
We need something that provides everyone equal dignity, an egalitarian system in this country which provides equal health care for everyone, just as we see in other developed countries.
So we have this enormous expenditure, and we have moderate at best results, and that plays out down where the rubber hits the road, where you all live, in the lives of the patients that you described who simply don't survive an illness because they couldn't access the care.
Children who are sick, hungry, they just cannot get educated as well as a child who is well fed and well medically.
I'd like to begin with a little perspective, which is that poverty is actually the natural human condition. It has been the dominant human condition throughout most of human history. So really the question for us is not what causes poverty, but what causes prosperity. And on that question, the jury is in. A market economy is the greatest anti-poverty program ever designed, or maybe I should say discovered, by humans.
You're not suggesting that the people of Denmark and Finland and Sweden are not free, by the conventional definition of the word.
Economically, I believe they are less free.
I think it's a moral issue, whether you say, I'm going to compare the health of the poor now to the health of the poor 25, 50 years ago, and say, oh, you're doing great, they're doing better. The health of the affluent in this country represents a standard that should be possible for everyone. There is no medical reason why everyone shouldn't attain that.
I can't tell you how many times people come up to me and say, here's where I'm at. I'm in my late 50s, early 60s. I'm just trying to figure out how to bridge the gap until I can be under Medicare, because my health problems and my inability to pay for them are basically dominate my life.
We have learned that in the United States of America, health care is better than it is in some of the poorest, most desperate countries in the world. But frankly, I think that gives cold comfort to millions and millions of people. It almost speaks to the rather poor shape that we're in when we're comparing ourselves to third world countries who are much, much poorer than we are.